But we are learning a treatment used early on in outpatient settings to treat COVID-19 can keep mild to moderate cases from getting worse. But as NBC4's Patrick Healy reports, its use and availability is still somewhat limited.
Not every hospital, clinic, or outpatient center offers it. Pomona Valley is one that does, outside ER, inside this nondescript mobile clinic, where yet to be hospitalized COVID patients who come to the ER and who qualify can receive an infusion of MAB, monoclonal antibodies. MD Ken Nakamoto.
In general, they're supposed to have a lessening of their symptoms and they get better more quickly.
At a time when a flood of COVID patients is pushing hospitals to the limit, MAB has a track record of treated patients who recovered without having to be hospitalized. Since last month at Pomona Valley, 230 have received MAB.
I have not noticed personally that any of these patients have come back, have required ICU.
Under the emergency use authorization, MAB is not for every COVID positive. You must be within 10 days of onset, considered at risk, but with symptoms not yet severe. The synthesized antibodies first gained attention in early October when given a share of the credit for President Trump's rapid recovery from COVID. The federal government agreed to cover the cost of providing MAB.
If we had greater supply, we probably could do more.
He gives MAB much of the credit for helping keep beds available at Pomona Valley. Across LA County, more than 8,000 patients are hospitalized with COVID, 10 times as many as just 2 months ago. In many cases, healthcare personnel have been transferred from outpatient clinics to inpatient care. The outpatient centers that remain in operation also feeling the stress. MD Tasha Dixon at the MLK Jr. Outpatient Center.
We've all had to really rethink how we're providing the care while still trying to provide the best care that we can. But it's becoming tougher and tougher by the day.
In Pomona Valley's experience, MAB infusions can help.
Even if it's only a small number of patients being kept out of the hospital, I think that it is of an advantage.
But elsewhere, perhaps as yet underutilized, LA County's Department of Health Services today told us it is investigating ways to deliver MAB to our patients, but is not currently doing it, unquote. And in talking to physicians, we've learned that many are not aware that prescribing it is an option that can keep many COVID patients out of the hospital. Reporting live, Patrick Healy, NBC4 News.